Okay, everybody, welcome back to the World Autism Summit. And with Dr. Sharon Buchalter, I'm so thrilled to have her. She's on our board. She's also done a wonderful presentation here. And Dr. Sharon Buchalter is a distinguished clinical psychologist, life coach, and social skills expert with over 25 years of experience. She is dedicated to empowering individuals, couples, and families to overcome challenges and thrive. Dr. Buchalter specializes in working with diverse population, including children, adolescents, and adults facing anxiety, trauma, and family conflicts. We all know we have those. As a certified peers provider, she offers evidence-based social skills training to help her neurodiverse clients build stronger relationships and improve communication. By emphasizing their strengths, Dr. Buchalter fosters growth and transformation, empowering her clients to overcome challenges and life-fulfilling lives. And so I'm really thrilled to have you here. And so nice. I see that you've got a wealth of books in the background. And
Thank
have
you,
you read them
Karen.
all?
I'm so happy to be here, and I'm so happy to be a contributor to this wonderful World Summit that you have worked so hard to put together with your wonderful team.
Correct. With the help of people like you. This sounds like a commercial, okay? But she's very near and dear to the Autism Today Foundation and to my heart too. She's from Florida. I'm from Florida. She is getting ready to prepare for a hurricane. And so I'm really very much thankful that you've taken the time to do this right before the hurricane. I know that Florida just got hit with a tremendous hurricane, and now you're heading right into another one. So I know you must feel very shaky.
Yes, and it is a challenge also for people that are neurodiverse, even more so because of the stress that's a hurricane brings to people, and having preparation for that is so important with people that have family members that are on the spectrum, as well as everybody. So it's a stressful time, but hopefully we'll bring you wonderful information today, and it'll be something that you'll keep forever and learn from. And I'm really happy to be part of this. And I hope that everybody that is here today that's listening to this will impart some really wonderful, valuable information and be able to act on it and see changes. So I'm very excited to be here, Karen, and I thank you. And I thank everybody for being here at the summit.
So what inspired you to be, in particular, involved with the World Autism Summit? What is it about it being global that's important to you?
Well, as a clinical psychologist and a parenting and social skills coach, I joined Autism Today board because I'm deeply passionate about helping the neurodiverse individuals and their families thrive. Being a part of the board and now the World Autism Summit allows me to contribute in a global scale where I can advocate for better understanding, inclusion, and support for those on the autism spectrum.
That's wonderful. And so how do you plan to share your expertise to make the biggest impact in the world?
Through my expertise, Karen, I hope to drive meaningful change for promoting early intervention, enhancing social and communication skills, and providing tools for parents to navigate the unique challenges of raising a neurodiverse children. My goal is to foster environments where the neurodiverse individuals are empowered to reach their full potential and feel genuinely understood and accepted by society. That's my true passion.
That's wonderful. Well, I'm gonna have to put you in my backpack so we can go over to India and
Thank you.
Africa and all those exciting places.
Excited.
And tell us what you're presenting today. This is where you can share your presentation. And are you going to be telling that story? I know is that going to come later, or?
We're going to be talking about a special story and analogy, but I'd like to say I'm going to be talking about the emotional stages a parent goes through after the diagnosis,
Right.
The practical stages, we're going to cover early intervention, social skills, psychological and academic support, and the presentation will definitely emphasize the importance of advocacy, collaboration, professionals believing in your child's potential, and working closely with them.
Nice. Sounds like
Thank
a jam-packed session. I know you put everything into these things when we've been going back and forth, and you put your heart and soul into everything. And
Absolutely. That's what I'm hoping. I'm hoping that that's going to be the case. And that's what I
now,
hope everyone will get out of that.
this may be a little bit redundant, but what do you want to share globally? Like, what message do you have?
Well, I aspire to shift the way the world approaches autism, focusing on inclusivity and focusing on individual care and greater access to resources and support systems that families desperately need.
Well, that's the truth. Okay. And then I would love to see this presentation, and
I'm going
I'm
to be
excited. I
making it
put so much
very
about.
soon. I'm going to have it very soon. So,
Okay.
get everyone ready.
So the last question I'm going to ask you at the very, very, very end after the presentation is done. So did you want to share anything else before you do the presentation?
Yes, I want to acknowledge that everyone has the courage to be here today. And I want to thank everybody for that. To receive an autism diagnosis in your child is life-threatening, and experience as a mom personally, I understand that. I'm not only a professional, but I'm a mom that has experienced that. However, I know the journey of raising a child is challenging and yet very rewarding. And I'm hoping with all of you, with love and support and advocacy and the right resources, all of our children will thrive and be able to reach their full potential. And that's what I wish for everybody.
Me too. It's a long journey, but it's worth it. It's worth it.
Absolutely.
And I know that many people come to that point where they don't know where they're going. They have no idea. You know,
And they're
they get a
scared.
diagnosis. Yeah. Like me too. I was sitting in the Safeway parking lot when I learned about my son, and I was devastated, and I didn't want any other parent to have to go through what I went through.
And that
Right?
was probably one of your motivations in starting your organization, which you've
Absolutely.
devoted your whole life to providing resources and to helping other parents and to helping people that are on the spectrum. And that in itself is an amazing ordeal. You spent your whole life, Karen. I don't know how many years, but you've spent numerous years in developing this and providing resources and took everything that you had to make this possible for people, not just through the World Summit, but in general through Autism Today, which has so many wonderful resources. And maybe you can speak about that afterwards.
Yeah, I will, but that's okay. Thank you very much. I really
Thank you
appreciate.
for having me.
Wow.
With
Okay.
no further
Um,
ado, we're going to go
well,
on to the presentation.
yes, is that going to be? I know I have a story that I gave you that's very special and near and dear to my heart that I want you to share. I don't know where that's coming in, but it was in my book. So I'm so happy that you're going to be sharing that story, because it meant the world to me and to Jack Canfield, Mark Victor Hansen, and Heather McNamara. So did you want to talk about that now, or what? I don't know where.
Yeah, yes, you are an author of Chicken Soup for the Special Needs Soul.
Yeah,
With you have
it's right here.
right there. Um, and you are a big contributor to that. And there's a special story in there that I'm going to talk about that was written by Emily. Where we are gonna we can't share the screen, Karen, so I need to, okay. So I'm going to talk about the story from Emily Pearl Kingsley. And it's a story where she talks about, and I think everyone can relate to this, that
Mhm.
she's going on a trip to Italy. And when she goes on a trip to Italy, she is basically all excited. She's visualizing the vacation. She's checking the tourist books. She's checking everything, everybody that writes about travel. She's doing everything. She gets her tickets. She gets her family excited. She's doing everything possible. She's packing her bag. She's counting. And she finally gets on the plane. And hours later, the plane lands and is in and says, "Welcome to Holland." And she thinks to herself, "Emily, you say Holland? What do you mean Holland? I signed up to go to Italy. I'm supposed to be in Italy. All my life, I've been dreaming of going to Italy. But there's been a change in the flight plan," the stewardess says. "They landed in Holland, and there you must stay. But there's been a change in the flight plan. You've landed in Holland, and there you must stay. But you've landed in a place where you cannot leave, and you must enjoy what Holland has to offer." So Emily points out that Holland may not be Italy, but as you learn about the country, the language, and the people, you start to appreciate the beauty and notice the windmills and the great cheese and the tulips and what makes Holland different from Italy. But you still mourn the loss of not realizing your dream, which is to go to Italy, that you planned for. She goes on to say that the pain of what will never, ever, ever go away, because the loss of that dream is very significant. And that loss is spending your life mourning the fact that you didn't get in Italy is a choice. But you may never be free to enjoy the special and very lovely things about Holland if you focus on that. Many parents of children that are on the spectrum, and I have to say, reading this story, I was very emotional, and it was very hard for me because this really hit home for me, because the expectations are unending, upending what you imagined before you have a child, and the unexpected journey can have incredible beauty and strengths to be discovered. But initially, the emotional journey can be like a roller coaster. And so we're going to talk about that emotional roller coaster and what some stages that you may be experiencing as a parent. I know I have experienced those stages, and I know people in my practice that come to me have experienced it. And I'm going to share that with you. And then we're going
That's
to go over
great.
practical steps and valuable resources that are available to help you navigate this path. And so now, with no further ado, we are going to go into the hope and support that's there for you with the PowerPoint. So Karen, I'm just going to ask you to stop sharing your screen so I can give everyone
You
the
got
power,
it. You got
and
it.
we're ready to go without any further ado.
You should be able to share. Yeah, you should.
Okay, so let me tell you before we get to the pages on the stages we go through, I have to say that it's from Kubler-Ross, Stages of Death and Dying, because even though we're not talking about death and dying, thank God, these stages are very similar. And what I have found in my practice, this is a very, very stable way of looking at it. And most of these stages are stages that at one time or another, in this order, that parents have gone through.
Well, it's really the death of a relationship or an expectation.
Exactly. It's a roller coaster. And receiving an autism diagnosis for your child can be profoundly overwhelming and life altering. It's common for parents to feel a whirlwind of emotions, like being on a roller coaster.
Right.
We'll review the emotional stages that are very typical that are experienced after your child is diagnosed with ASD. When you receive your child's diagnosis, you may feel a wave of shock and disbelief. It may feel like the news is happening to someone else, and you may have difficulty comprehending the situation. You might experience a sense of numbness and detachment as if you're in a dream. At this stage, it's important to acknowledge and process your feelings. Don't try to suppress it or ignore it. Some of the coping methods that have worked very well are seeking support from loved ones. Talk to your partner, your family, or friends about your feelings. Join a support group. Connect with other parents who have received an autism diagnosis. And take breaks, engage in activities that help you to relax and decompose and de-stress. This is very important. And I do want to emphasize, not everyone goes through every one of these stages. This could be in a different order. Some of them may be skipped, but this is very common to feel this way. And you may feel right now like you're all relating to this, and this is not uncommon. A second stage is anger, frustration, and guilt. After the initial shock, you may start to feel angry or frustrated with yourself. You may question your parenting choice, or did you do anything to make this happen? Wondering if there's something you could have done differently, or maybe the diagnosis is wrong even. It's important to remember that these feelings are completely normal. Many parents experience similar feelings after receiving an autism diagnosis. It's not your fault, and you are not alone. Please know that. Coping methods for this is practicing self-care. Prioritize your physical and your mental health. You're no good as a parent when you can't be healthy yourself for your child. Challenge your negative thoughts. Remind yourself that you're not to blame for your child's diagnosis. And seek professional help if necessary. A therapist can provide guidance and support during this difficult time. Bargaining and searching for alternative explanations. This is a big, big point that a lot of people go through. And I see people during this stage often. This is a stage where you may start searching for alternative explanations or hoping for a different outcome, hoping to find a different diagnosis. You may research unconventional treatments or seek out a second opinion, which I recommend. It's important to remember that while seeking information is helpful, it's crucial to accept and move on when you know that it is correct. A coping method would be educating yourself about autism. Learning more about the condition can help you understand and accept the diagnosis. I remember with myself, when I got the diagnosis, I didn't believe it. I had a junior intern that worked in a psychology office. My daughter was very young. She had a very hard time in the classroom, couldn't sit still, walking around in circles, wouldn't participate in a group. And I remember thinking, oh, she's just hyper. That's what it is. And this woman is wrong. What kind of tests did they give her? And I questioned everything, especially since I'm a psychologist and I knew what could be the tests they could be giving. And I questioned it. And for a while, I actually hid the psych report and I put it away in the drawer. And I said, I'm going to look for another opinion. And sure enough, a couple of years later, I went for a second opinion, and it was a different diagnosis because there's a lot of comorbidity with ASD. But the reality was the social skills and the issues with socialization were very evident by that time. So, especially if your child's young, you may see speech delays or things of that sort. But in reality, as they get older, it becomes even more evident. But early intervention is important. We're going to talk about that. So seek a second opinion. If you have concerns, consult with other professionals. Don't just talk to other parents. Don't get hearsay who's, someone sitting on the bench who thinks they know better. Go to people that are qualified to make diagnoses. Focus on the present. Rather than dwelling on what you could have been, focus on the here and the now and be mindful about it. Sadness and grief. The reality of the diagnosis will set in, and you may feel of sadness and grief. This can be likened to mourning for the loss of an original dream vacation and the disappointment in experiencing it not the way you imagined. You begin to realize that your child's future may look very different than you had originally envisioned. Dreams of your child attending college or pursuing a career of their choice may be difficult, and that's something that we all have to face. Some of the coping methods is allow yourself to grieve. It's important to allow yourself to mourn the loss of these original expectations and process your feelings. Remember, you're not alone in experiencing these emotions. Express them. Talk to someone you trust, then and seek professional help. If there's nobody that's a friend or a family member that you feel comfortable talking to, get professional help. Celebrate your child's strengths. Don't forget to focus on the positive aspects of your child's development. For instance, a child with autism may become highly skilled in drawing, playing a musical instrument, being very big in the visual arts, solving puzzles, working with IT, and due to this intense focus and attention to detail, there are many jobs out there that people with autism would be very fit for and can really have a great career. And acceptance and resilience. With time, support, and understanding, you'll be able to find a path of acceptance and resilience. There are countless other parents who have experienced similar emotions and find strength in connecting with one another. Remember, you're not alone on this journey. Over time, you will come to accept the new reality and find ways to appreciate the beauty and the uniqueness of your child's journey. Coping methods include focusing on the present, enjoying moments with your child, appreciate their unique qualities and what beauty they bring to the world. A child with autism may have remarkable ability to focus and concentrate for extended periods of time. Spend those times with your child and talk to them when you can and make that special time together. Set realistic goals, develop achievable goals for your child's development. For example, a goal may be to increase their ability to initiate conversation with peers. You can start by working on simple greetings and generate gradually building up to more complex conversations. And celebrate your child's success. Acknowledge and reward your child's achievement, no matter how small. Now we're going to talk about practical steps. What are the practical steps parents should take immediately following an ASD diagnosis? Receiving a diagnosis can be very overwhelming, but taking proactive steps can make a significant difference in your child's journey. We will next review the practical and proactive steps parents should take immediately following the ASD diagnosis. Seek early intervention. Evaluation. Early intervention is essential with children with autism. It involves providing tailored services and support to address your child's specific needs. By starting early, you will significantly improve your child's development and quality of life. The first step is to have a team of professionals evaluate your child to identify their unique strengths. This will help determine the most appropriate support services for your child. And I must say that getting an appropriate diagnosis should come from a clinical psychologist, in some cases a psychiatrist, and a group or a support group that is specialized in diagnosing ASD. It is not something that somebody can just tell you. Even a teacher in school may suspect it, but they cannot diagnose it. And we'll get more into this because I want you to be real informed about this. It's important. The evaluation may include things like communication, language skills, speech and nonverbal communication, cognition. How does your child problem solve? How do they learn? What's their memory like? And executive functioning. They'll probably get an IQ exam assessment to look at their intelligence. That's under cognition. They'll probably be tested with something called the Woodcock-Johnson, which is for reading and math and academic success. Somebody will, in some cases, if you have a team, will evaluate gross motor skills, walking, running, and fine motor skills, such as how your child uses utensils or writes. And the social and emotional, social skills, emotional regulations, and behavior may all be part of the assessment. And a comprehensive assessment will include these things. And including, based on evaluation results, early intervention can provide valuable support in your child's specific needs. Some of these services will be, that is included, is what's called an applied behavior analysis. We call them ABAs. This is therapy that focuses on improving specific behavior with reinforcement. ABA can help children with autism develop new skills, reduce challenging behavior, and increase independence. Speech therapy, that's usually key at a very young age, addressing communication challenges such as difficulty with expressive and receptive language and speech communication, and what's called pragmatics, which really is helping a child with everyday socialization in speech. Occupational therapy, helping children develop daily living skills, sensory processing, and fine motor skills. And in some cases, you may need physical therapy, supporting physical development and addressing gross motor challenges. Build a strong support team. How does one do that? Connect with other parents who have children with autism. This can be incredibly beneficial. It wasn't until later on, when my daughter was a teenager, that I really was able to take advantage of this. And I felt very isolated when my child was younger. I used to go to traditional mommy and me groups or dance classes, and every time things were different. I wasn't invited with all the other mothers and their children because my daughter didn't really do the girly things that other girls did, and she ran away from the groups and just acted a little different than the other kids. And I was ostracized as a parent because of that, and that was very painful. So I think it's important, and I'm talking to you not just as a professional, but as a mom now, who has experienced this, that it's important to get strong support systems early on. How do you get that? Join local support groups. Many communities have social support groups specifically for parents of children with autism. These groups offer a safe and welcoming space to share experiences, seek advice, and build friendships. I know we have in Florida, where I'm based, CARD, which is an organization in different counties where they provide a lot of support through professionals and through support groups every single month. And I know that you can look this up and find groups in your own community, whether you're in any part of the world. Join online communities. These are
Yeah.
numerous online forums, such as Autism Today. There are special media groups and online support groups dedicated to this. These communities can provide a global network for support and connection, which Karen has skillfully provided to all of you around the world. Attend autism conferences and events, such as this one. These events often include opportunities for parents to connect with one another and learn from the latest resources and information. An autism organization, again, Autism Today, can be a valuable resource that can provide support groups, education materials, advocacy services, and you connect with other families as well. In particular, I got my daughter into the iSocial groups, which was through Karen's Autism Today, which is an invaluable group where she has learned social skills and gets together with a whole group of other teenagers and young adults to learn all types of social skills. And she actually loves it. And I have seen tremendous growth in her. So always take advantage of that. And we even have it for younger groups. You can be paired with any homogenous group in your child's age group. We have that for you. So use it. Remember, you're not alone on this journey. By connecting with other parents and autism organizations, you'll build a strong support network that offers emotional support for you your family, practical advice, and advocacy. And how strong support systems can benefit you, it'll help your feeling not so isolated, so you don't feel alone. That'll alleviate your stress and anxiety because children pick up on that. So you don't want to be stressed out and anxious all the time because you feel so alone. It'll provide practical advice. Learn from the experience of other parents. I learned about a group on Facebook that was for children, or I should say young adults and teenagers transitioning to college. What colleges are best to support people who have ASD? And there's a whole network of other types of groups, even on Facebook. So don't be afraid to look at it and connect with other parents. You'll receive encouragement and empathy from others who understand what you're going through. And you're not alone, because when you connect with other mothers that have children that don't have difficulties, it could be also very stressful because you're also helping your child to try to fit in with other children that they may not fit in with. And then you become more stressful. So it's important to connect with others that have children that are on the spectrum, and that they can provide support the parents and also help with the children. It empowers you to advocate, connect with other parents that are compassionate and passionate about advocating for the rights and needs of children with autism. Educate yourself about autism. ASD is a complex neurodevelopment condition affecting communication and social interaction, but it's a spectrum, meaning there's a wide range of severity and symptoms. Children with autism may face challenges such as communication difficulty, social impairments, processing problems, sensitivities, and repetitive behavior. Others often possess unique strengths such as intense focus, exceptional memory, incredible creative talents. By understanding the different types of autism, even though they're all structured under ASD, which is more of a newer diagnosis because it used to be in fragments in the diagnostic manual we use as psychologists, but now everything is under ASD. So everybody is in a spectrum there. So we have people that used to be called Aspergery, they're in the ASD, and then the people that are nonverbal as well as verbal are now all under the ASD diagnosis. It was a way to provide better treatment for parents that needed it, especially in the school system. And you will be able to understand different types of autism and the range of challenges and strengths that you can better support your child with and advocate for their needs. And remember, every child is different. Educate yourself about autism. Watch webinars, online classes, such as the World Autism Summit. That can be a wonderful way to learn and get online resources for autism. And workshops and webinars are always available online. Attend workshops and conferences like this one. It's a valuable way to learn from the experts in the field and from other parents. These events often feature presentation, panel discussions, networking opportunities where you can hear talks on the latest research, best practices, and available resources. Join online communities that can provide a convenient way to connect with other parents and share information. There are numerous online forums and social media groups and support groups dedicated to autism. Read books and articles. Can be a great way to deepen your understanding of autism. There are many books and articles that are available on this topic, covering a wide range of topics from diagnosis to treatment to parenting strategies. Look for books from autism experts such as Temple Grandin and Tony Atwood. I'm also going to provide some resources at the end. Create a structured environment. This is extremely important. Create an environment that will help your child with autism feel more stable and more confident. How can you do this? Establish a routine. Use consistent schedules for daily activity, meals, and bedtime. Wake up time, every day, certain time. breakfast, school, play, dinner, bath, and bedtime. Very important to have predictability and structure for your child. Use visual aids. Picture schedules and social stories can help your child understand expectations. Use a picture schedule to show the sequence of activities for the day. Create social stories about a social situation to help your child understand expectations. Create a calming environment. Reduce clutter. Use calming colors. Provide sensory-friendly spaces. And keep your home free of clutter and excess stimulation. Use soft colors and natural lighting. Create a quiet corner for comfortable seating. A bean bag, a comfortable seating area even in your child's room, or a special safe area in your home when they may need to decompress is very important. Collaborate with professionals. Build strong relationships with professionals involved in your child's care for essential providing support. Communicate openly and honestly. Share your child's strengths, their challenges, and their goals. Share specific examples of your child's strength. Take notes so that you can talk about this with the professionals. Ask a lot of questions. Don't be afraid. Don't hesitate to ask as many questions as possible. Ask about specific techniques that you could be using at home, in therapy sessions, expected outcomes. Ask for reviews every so often on their progress, and be an active participant. Take an active role in your child's care. Attend meetings, review progress notes, and provide feedback on what you see in your own child's development. Remember, a parent knows their child best. I always believe that in my practice. I always, no matter what I see in their child, I always go with what a parent goes and tells me what they see and they observe, because parents do know best about what's going on with their child. And if you have somebody that thinks they know better, then I'm not so sure that that is a right fit for you. It's very important that you're listened to as a parent. Advocate for your child's need. Ensure your child is receiving appropriate services and support. This is especially true in the education system, which we're going to get into here. If you feel your child needs additional resources or accommodations, you must advocate for that in the school and with all professionals involved. Build trust. Build trusting relationship with professionals that are all involved in your child's care. Share your concerns and questions openly and listen to the professional's recommendations. Even if you don't believe or you have a different opinion, don't be afraid to speak up about it and try to come to a compromise if something doesn't seem right for you with that, or change for professionals. Collaborate with professionals. Develop a comprehensive plan. Create a plan that addresses all aspects of your child development. Ensure your child receives the very best possible care. Gain valuable insight and guidance. Learn from the expertise of professionals who specialize in autism. It's very important that you provide and get somebody or get a team of people that know how to work with children or young adults or teenagers on the spectrum. Feel more supported and empowered knowing that your team of professionals are working together. And remember, you are your child's best advocate. If there's no better person on this earth than you as a parent to know what's best for your child. Now, how can a parent support their child's social and communication skills? This is very, very important because most people on the spectrum have this as something that's very fundamental to being neurodiverse. So developing strong social and communication skills is crucial as a goal for many parents of children with autism. These skills are essential for building relationships, participating in school activities, communication activities, and leading fulfilling lives with peers. Social skills training. Join social skills groups. These groups provide opportunities for children to practice their peers-related structured setting. A child with autism may join a social group when they learn topics about how to make a conversation, how to make eye contact, how not to interrupt. That's what iSocial does. That's what I got my daughter involved in. Practicing social interactions at home, do role playing, and practicing social skills in everyday situations to help your child generalize these skills in the environment. A parent and a child can practice greeting people, asking questions, expressing feelings. What I used to do is I used to go in a magazine and I used to cut out pictures of people expressing different emotions. And I used to put it on a board and we used to talk about, like, what do you think this person is feeling? What do you think this person looks like they're feeling? Based on just their facial expressions, so they understand. Or an occupational therapist worked on a feeling chart. So there were things like when you're on red, that means you have to stop and pull back, or when you're on green, you feel okay, and when you're on yellow. So it was done through color codes of how a person feels, and this is something very commonly used with children that have autism. A parent can also seek one-on-one therapy, individualized therapy, targeted supporting strategies for improving social skills. And they also may work with a therapist to develop strategies for understanding social cues and responding appropriately. Speech and language, very big. Speech and language is essential for children with autism. It'll help them improve their expressive and receptive language skills and their overall quality of life. A speech and language pathologist can provide targeted speech and language skills to address a child's specific communication needs. Here are some examples of what a speech and language pathologist does with children that have autism. They teach alternative communication methods. For children who struggle with verbal communication, an SLP, which is a speech language pathologist, can teach them to use sign language. They can use a picture exchange communication system, which we call PECS, or a speech generated device. A child who has difficulty expressing their wants and needs might learn to use a PECS board where they exchange pictures to represent objects or actions. Involving verbal communication skills for children who can speak, an SLP can help them improve their vocabulary, grammar, and sentence structures. An SLP works together with your child. And I know the speech and language person that works with my daughter uses a lot of online resources and does a lot of role playing where she initiates conversation, and she does it through storytelling. And it's very exciting, and my daughter loves it. So that's something that most speech and language therapy, if they're good and they know how to specialize working with autism children, will work with your child like that. They can also help them learn to pick up nonverbal cues, engage in conversation, and participate in social interactions. They can teach a child how to take turns in conversation, maintain eye contact, and also look at social skills. And I mentioned this earlier, pragmatic language. It talks about social rules of communication. Help them to understand. They may teach your child to adjust to communication styles, different social situations, when you're speaking differently to a friend versus an adult or a teacher. By working with speech and language pathologists, children with autism can develop the skills they need to interact with others, express themselves, and succeed in school and in life. Encourage play. Encourage play and interaction. It's very important in building social skills. Create opportunities for children to play with other children, even if it's for short periods of time. Focus on activities that promote taking turns, sharing toys or objects. A child with autism may want to play a board game with a peer, and taking turns is very important. And something that I noticed early on, it's very important if your child is playing with somebody that doesn't have a diagnosis of autism, and they're relatively young. They're pretty forgiving about things that your child may not take turns or want to walk away. But if you supervise and you're there as a parent, or it's done through with a speech therapist or even a play therapist, that it can be something that can help your child really navigate. Because if they're not both in a group at where they both are diagnosed on the spectrum, it may be a little harder on your child that has the diagnosis and the child that doesn't, if somebody's not involved in orchestrating this connection. And this is something important to know, that work together to provide a common goal. A child with autism may work with peer to build a sandcastle or complete a puzzle, but you may need to supervise that. Building social skills takes patience and consistency, but with the right support, your child can make significant progress from a very early on age. How can a parent support the child's emotional well-being and their academic success? This is very, very important, because starting a school, what's called an individual educational plan early on in early intervention, is crucial. Support your child with autism's emotional well-being and academic success is essential. How can we do that? What's the best method? Okay. An example may be counseling. A therapist may help your child develop coping skills for managing their anxiety, their stress, and social challenges. You may also have family therapy, providing support and guidance for the whole family, for their siblings that may not be diagnosed, that also have to deal with coping strategies. Address the emotional impact of autism on all family members. It would be invaluable. Okay, and then the applied behavior analysis. An applied behavioral analysis, and we talked about this earlier, and now this is going into a little more depth. What do they do with your child? They help reduce challenging behaviors. Some people that are on the spectrum, especially children, they don't understand what's really going on with them, and they can start acting out to get attention. They don't understand, they're frustrated. So an ABA may work with them to teach a child how to not only initiate conversations and take turns and share, but reduce challenging behaviors using positive reinforcement, decrease problem behaviors such as tantrums and aggression. Sometimes people on the spectrum can get physical. Children can get physical. They work with those things. And they also help with daily living activities, teaching skills like dressing, brushing teeth, and using the toilet. Something that fundamental. And now, what are the academic accommodations? This is where you must be a big advocate, because if not, your child will fall through the cracks in public school or private schools. Academic accommodations are crucial. So what do you have to do? You have to collaborate with your children's school to develop what's called an IEP, an individual educational plan. What will that do? It'll provide accommodations for your child. And sometimes a teacher may just not even do these accommodations, okay, unless you have an IEP. This is very important. And if you can't do it on your own, I hire a parent advocate. There are always parent advocates out there. You can find out the best ones, and they will advocate with you if you need it. And if you have to even get an attorney, some parents will advocate all the way up to the superintendent of schools. And I know people that have done that. I'm not saying you have to, but if you don't get any headway in doing it yourself, those are really the extreme measures, but you may have to go that way. Some of the things they may accommodate is extended time on assignments, preferred seating where there's less distractions away from windows and other students, maybe in front with the teacher. Assisted technology, using tools and devices to support learning communication, such as speech-to-text software, visual organizations, and help your child who's struggling with handwriting. Reduce workloads, adjust the amount of homework or assignments to accommodate your child's individual needs so that they're not going to feel overwhelmed. Explore resources like special education programs or tutoring if available. A lot of the public schools will have a program where they'll put your child in an ASD track where they're getting extra help. I found with my daughter in public school, they didn't really provide what they said they were going to provide. And I had to take her out. And even lunch hour, I used to say, "Oh, why don't you sit with so and so and so and so?" She's like, "How many times can you ask somebody to sit with you and they say no? And after a while, you stop asking." And I remember my heart went down to my legs, thinking, "Oh my God, how horrible must that be to have lunch like that?" And I even told the school I wanted to come on my lunch hour from work and sit with her, and they wouldn't let me. So they ended up having a supposedly a peer program during lunch that other students would come and sit with kids that had more difficulty interaction with others, but it never came to fruition. And I ended up putting her in a school that had more accommodations for special needs. So you really have to look at what do you get, what are the best accommodations for your specific child. Behavior management techniques. This is very important because if you have challenging behaviors, you want to provide positive reinforcement techniques to encourage desired behaviors and specific problem areas. Some positive reinforcement behaviors may include a reward system, praise, verbal praise, privileges to encourage desired behaviors, what we call a token economy, where they can gain from gaining exchange, not really a token, but check marks for certain behaviors that they're engaging in that are positive, and have them get an extra privilege or an extra ice cream. I don't like to use food too much. I know some people, the ABAs, use M&Ms and things like that. I don't like to get into that, but maybe a privilege, an extra privilege, extra time with mom and dad, whatever it may be, more time, with a friend. That could be a plan, but you may set that up with a therapist. Develop a plan to address specific problems, aggressive behavior, self-injury. A behavior intervention plan will involve positive reinforcement and to help reduce aggression and teach alternative coping skills. And remember, seeking support and advocacy for your child is essential for their overall well-being. And by working with professionals that provide necessary support, you can help your child reach their full potential. What additional services might be beneficial for a child with ASD and their family? Beyond core therapies and support and all the things that we talked about, there are additional services that can be beneficial for children with autism and their families. Occupational therapy can be, and this is not for everyone. When you get the assessment, you'll find out if you need this. Occupational therapy can be a valuable part of a comprehensive treatment plan for your child with autism. Addressing sensory processing issues. Sometimes you have to wear a weighted vest. They have all kinds of things in the classroom to help them to feel grounded. It'll help them to improve their daily living and to thrive in a very positive way. It'll improve sensory processing and improve daily living skills, how to use utensils, how to dress, how to groom, gross motor skills, even walking and running. Sometimes children that have autism could be a little clumsy. They don't have coordination. So you want to address that. What are the benefits? Again, increased independence. Performing daily tasks for independence is so important. Greater participation in a wide variety of activities to help them feel comfortable in different settings, and improve their quality of life and improve their sense of well-being and confidence. That is everything. And social services. Social services require valuable support for families and children with autism. It helps navigate a complex system, and believe me, it can be very complex. Respite care offers parents a temporary break from caregiving responsibilities. This can be extremely overwhelming for parents to be able to do this every day, 7 days a week. So it's a time to recharge. Respite care can provide in various settings, in a family setting, a professional caretaker's home, or in a specialized facility. Case management can help families navigate public assistance programs, assess valuable resources, and case management can help with identifying special eligible programs, determining which government program or services a family may qualify for based on needs of your child, financial needs as well. Completing paperwork, they'll help you with that. They'll help families fill out applications and gather all the documentation you need. Advocate for services representing families in need, and connect you with resources, referring families to community organizations. I connected with resources. My daughter is looking for employment, and I connected resources through CARD, our local organization for autism, and they helped me with resources for getting jobs, because it was very hard to try to get a job, even though she's trained as a certified vet assistant, to be able to work and go on Indeed and interview, because when she got on the interview, it was extremely hard for her to be able to get through the interview. So that's how I have utilized social services, even with my daughter being a young adult. And financial assistance, very important. Raising a child that's with autism can be financially very demanding due to the cost of therapy interventions. Fortunately, financial assistance is available. Government benefits such as SSI can provide financial assistance to individuals that have autism. Medicaid, there's something called Med Waiver. I don't know if this is all over the world, but we have in the United States Med Waiver. There's a 10-year waiting list. So when you get that diagnosis, it's important to get on this waiting list to be able to get medical expenses paid for, including therapies and treatment for your child. Grants and scholarships from various organizations can also provide assistance for families of children with autism. Contact your local Department of Social Services and reach out again to organizations such as AT, Autism Today, that may be able to help you advocate for social services in all different states and maybe even around the world. And search online as well. And what is our takeaway from today's discussion? Remember, you are not alone. Seek support from other parents, support groups, and autism organizations such as Autism Today. Educate yourself about autism. Find out everything you can, all the resources out there. Advocate for your child's needs and build a strong partnership with professionals and other people that are in the same boat. And focus on your child's strength and celebrate who they are and the beauty of what they bring to the world, and celebrate their achievements in all areas of their life. I want to thank you for being part of this great summit. And if anyone has any questions, I'm here to answer anything you may want to ask me about my presentation. Thank you, everybody, for listening, and I hope I provided very valuable information for everybody.
Thank you so much, Dr. Sharon. We really appreciate you, and that is very, very wonderful information. And I know I had to go through the grief process too, like we all do. And sometimes you end up going through the grief process more than once, like at
Absolutely.
different times
Different
of your life.
stages, right?
Huh?
Different stages, it comes up again.
Right. Yeah, you have to go through the whole thing all over again when, in your 20s, 30s, 40s, 50s. You never know, you're always learning. So I really appreciate that perspective. And I think it's going to help a lot of families get on the right track and have tools to keep staying on that right track. And I noticed you have a track right there leading you from the beach.
That's
Or to
right.
the beach.
And if anybody, I'm out there. I'm a psychologist. I practice in Florida. If anyone's out there and they want to contact me, or I
Yeah.
can do telehealth as a parent expert and coach. I can work with people outside, but not as a clinical psychologist, more as an expert parenting coach. And I can be reached on my website through Dr. Sharon Fried Buchalter. And I have a website, and we have a contact information sheet, and I'll be more than happy. Anyone wants to follow up, Karen also knows how to contact me.
Yeah.
But that's a great way to find me if you would like to find out even more information or seek any professional help. I don't do evaluations anymore. I did that for many, many years. I do know people who do that are great, but I do provide therapy, and also with families and individuals as well, in the spectrum.
Well, that was a
So thank you for
wonderful,
inviting me. I'm very excited. And again, I so agree with you, Karen, about the stages that we all go through as your child goes through different transitions from elementary school to transition to high school and then to the real world.
yeah,
You go through stages again and again, and they're relived. So I think that's so true. I didn't mention that, but it is a fact. And
yeah.
so I think that parents need a lot of support, and you're not alone, and reach out to the people that are going to be supportive for you.
Thank you very much. Is there anything else that you want to share with the audience?
Just to say that, never be afraid to speak to people you trust, and feel that, you can't get help for yourself, because, it's a lot on a parent.
Mhm.
And I'm speaking as a parent now, just not as a professional, that sometimes you need self-care, and you need to address helping yourself, because you're only as good as how good you feel inside, and your children pick up on your anxiety and stress. So it's very important to get self-care, take care of yourself physically, emotionally, and don't be afraid to you know talk to people that you can
Right.
trust, family members, but not everyone understands. So select the people
No,
that you feel that really get it, and
yeah,
really that's why I say parents of other the children that have a diagnosis, where they understand where you're coming from. And the other
and
thing is
that's
that I didn't mention this, but there's a lot of comorbidities. So you may have a child that's on the spectrum, but they may have OCD also, or ADHD. And so there are a lot of overlap. So beware that you may have to get treatment modalities for all of the different things, and a lot of it overlaps. But
yeah. Mhm.
you may have to get
That's a good
specialists
point.
to share them. Yeah, yeah, that's very true. But
Well,
I just
thank you.
want to say that I think it's a journey, that's a challenge, but God, as they say, gives us what we can handle. And
Right.
so I
So
think
I
that
know you have to handle a big storm right away, so
oh
I wish
yeah,
you the very best.
thank
And
you, Karen.
yeah, you get out of Florida now. And I
Well,
wish
I don't
you,
know if we're moving anywhere, but we need to definitely uh, hanker in, and just,
yeah,
I'm glad we did a pre-recording, because I just want to make sure we got it done, and we know that in the next couple of days, I don't know what's going to happen with the internet,
right.
but I will
Lots
be
of
there
water
for
in the
panel
bathtub.
members. What?
Put lots of water in the bathtub.
Thank you. Thank you, Karen, and thank you for this opportunity. I really enjoyed
Okay.
it.
Well, thank you very much. We'll talk to you later.
Bye.
Bye.
Okay, thank you.